This is a video for a response to the electronic health records and clinical information. This is group number 1. There were 5 questions that was on the padlet. First question was, what are the difference between the electronic medical records and the electronic health records? Really, I always thought they were the same until I viewed the padlet. Electronic medical records it is defined as a narrow view of a patient's medical history, and it's used by mostly the providers for diagnosis and treatment, whereas electronic health records is more of a comprehensive report of the overall health. Question number 2 was, how does standardizing medical terminology benefit patients? The biggest reason that according to the padlet, that it is to be more standardized, it can facilitate the improvement or the interoperability and provides good communication. Because medical terminology sometimes can be a very hard thing to just to comprehend at times if you're especially if you're not in the healthcare facility or in the healthcare arena. Question number 3 was to name 3 benefits of the electronic health records, and how does it apply to practice. Well, the 3 benefits that I was reviewing, that it makes it much simpler to access patient data. It is more clear, more concise. It can allow a physician or a medical provider to follow care throughout the spectrum, and it provides more of the care centered around the patient. And how does this apply to medical practice? They all apply. In the practice in which I serve, that we use those electronic healthcare medical records to provide the privacy for patients, to provide care, and to make the flow of the workflow more concise. So question number 4 was, why should terminology be standardized in the electronic medical records? Again, this will make it clear. It will make it more easy to read, legible, and then there's the legalities of it. If it's not documented, it's not done. So if it is documented, it can provide as a report for legal reasons if it has to be there. And their final question was, what is clinical informatics? Clinical informatics, just by simple definition, is just is how medical records are interfaced with technology, and this is designed to improve healthcare, both patient safety and provide privacy for the patient, and to provide a communication pathway for both physicians or medical personnel, and it can help the patient to make sure the patient is more adapt to their health care by having their medical records at hand. And by the way, this was a good padlet. Thank you.